Cold-like symptoms could be something else entirely. You could be dealing with an allergy. 'Tis the season for fall allergies. Pulmonologist Dr. Michael McNamee is with Hospital of Central Connecticut.
We're in a season which we recognize as the peak season for environmental allergens such as ragweed, pollen, and so we often expect to see an increased number of patients with hospitalization or even just exacerbations that need extra treatment.
What triggers fall allergies?
Fall allergies are triggered by environmental antigens like leaves that are falling, mold, ragweed, pollen, things that are very difficult for patients to avoid in their everyday life.
How do you lower exposure?
People are used to reducing their exposure to allergens indoors by getting rid of carpeting and by covering mattresses. Outdoors is much more difficult. So what we rely on is the patients being faithful to their medications, using medications that will prevent them from having exacerbation even when they are exposed.
What's the difference between a cold and an allergy?
The symptoms can be very similar with sore throat, stuffy nose, runny nose, headaches, and you can get all of this with either. So with an initial episode, it might be difficult to separate an allergic reaction from a cold. We can try to differentiate by how the episode responds to medication, and also we understand a lot when we see if the episode is recurrent. If it's recurrent or persistent over a long period of time, it's much more likely to be an allergy.
What treatments are available?
We have a number of medications that can be used. There are steroid preparations as nasal sprays, which we use very frequently. We use non-sedating antihistamines so that patients can get some relief without being drowsy. And we have a whole variety of other medications, including medications that can be injected repeatedly